So tēnā koutou and kia ora everyone. It is with pleasure we bring you this webinar, and I'm just going to start us off with an opening karakia. Kia tau ngā manaakitanga a te meo ngaro, ki runga, ki tēnā o tātou. Kia mahia te hua ma kihikihi. Kia toi te kupu, toi te mana, toi te aroha, toi te reo Māori. Kia tūturu ka whakamaua kia tēnā. Hui e, tai ki e. Let the strength and life force of our ancestors be with each and every one of us, freeing our path from obstruction so that our words, spiritual power, love, and language are upheld, permanently fixed, established, and understood. Forward together. So it is with pleasure that we welcome you to this webinar, and really looking forward to the kōrero from the Thriving at Crossroads program team from the University of Auckland to Rashini, Vatika and Nikki. Welcome. Just a little bit of housekeeping. As per usual, we are actually recording this webinar, and also we have the Q&A function up and running. So during the presentations, please feel free to put in your questions or queries as we go along. I'm going to pass over to Rashini, and the speakers will present for about 40 minutes, and then we will bring the Q&A questions forward at that stage. Although bear in mind that the presenters are also going to keep an eye on the Q&A channel, so they may well weave in some of the responses to the queries that you've got as they go through. Yeah, I'm going to pass you over now to Rashini. Kia ora, Rashini. Thank you.
Kia ora, Bev. I'm going to share my screen to start us off. And can everybody see this? The titles, yeah, thank you. So thank you, Bev and Community Research, for inviting us to present Kia ora tātou katoa, and now my haere mai to everyone who have come for this session. As researchers, there is no greater satisfaction than to know that our work is of interest, and that our findings are used for tangible impact to the communities we serve. First, I would like to reiterate that as Tawiwi, we recognize the substantial needs of tangata whenua, and when we speak of resources and policy support, we want it to benefit all, including Māori, and importantly, without reducing their share. This presentation focuses on ethnic minority youth, that is, youth with origins in Asia, Middle East, Latin America, and Africa. At times, however, depending on the data that is made available to us, we will share data on Asian young people only. We know that the issues and the solutions, however, will be of relevance to all ethnic migrant youth. We are also fully aware of the sensitive nature of the topic we are discussing today, being on mental health. If support is needed, we encourage you to please reach out. We will be posting some contacts in the chat that may be useful for you, and Vatika will post those contacts on the chat for anyone who may need it. The webinar is delivered by University of Auckland's Thriving at Crossroads team. Thriving at Crossroads is a health research funded project that is exploring how varying social identities of ethnic minority youth, including their migration generation, for example, or their gender identity, their religious affiliations, etc., how these identities intersect with their mental health and well-being. We have three presenters today, and first off the block will be Nikki Singh. Nikki is our youth presenter today. She is a stellar PhD candidate at the University of Auckland, and she's researching autoimmune diseases and identities for young adults in Aotearoa. Born in New Zealand, Nikki is of Fijian Indian origin. And she has led research on Fiji Indian dual identities and been involved in multiple projects, including on intersectionality and safe spaces for ethnic minorities. She is a valued member of Thriving at Crossroads Youth Advisory Group and has contributed as a youth researcher on the project as well. So welcome, Nikki. Our next presenter is Vartika Sharma. Dr. Vartika Sharma is a senior lecturer at the Faculty of Medical and Health Sciences. She was for many years the principal research fellow for Thriving at Crossroads, carrying a significant weight of the project on her shoulders. Born in India, she is a relatively recent migrant to New Zealand, and she currently leads a Health Research Council-funded project to build community-led interventions to better support the mental health of ethnic minority youth in Aotearoa, New Zealand. Lastly, I'm a co-director for the Center for Asian and Ethnic Minority Health Research and Evaluation, CARE, at the University of Auckland, and also I'm the Asian and Migrant Lead of the Youth 2000 National Secondary School Surveys. I have had the humble privilege of leading Thriving at Crossroads from its inception. I was born in Sri Lanka and moved to New Zealand about 15 years ago with 3 young children whose lived experience in New Zealand is reflected in the findings we share today. Vartika and I are also in the team that will be delivering New Zealand's first child and youth mental health prevalence survey soon, which is funded by the Ministry of Health. In this presentation, we draw findings from Thriving at Crossroads and also from the Youth 19 project, and more details from both of these projects may be found in the links provided here. And with that, it is now my pleasure to invite Nikki to deliver her presentation. I will stop sharing and invite Nikki. Are you able to share, Nikki?
I think you're still sharing.
Am I still sharing?
Yeah.
Ooh, I'm not sure how I can stop sharing now.
That's okay. We can also work. We can go off your slides too if we need to.
I'm so sorry. I can't stop sharing. I'm not. Maybe that is how it is set up.
You should be able to do a stop share because you've come out of presenter mode.
Yeah.
Full screen to your.
If I click the share thing, it's just sharing, letting me share again, but not to stop sharing.
Maybe click share and then try it again. Share and then stop share and see if that works.
No, it is not.
Ah, there we
There
go.
we go.
Okay. I don't know what I did.
Cool. All right. So, yeah, kia ora everyone. I'm Nikki, and I'm so happy to be here. So I'm just going to start with like a brief overview of ethnic minority and youth mental health and things like that, and what safe spaces are, and then yeah, I'll pass it on. So. As Roshni said, that in this presentation, ethnic minorities encompass those who identify with Asian, Middle Eastern, Latin American, and African origins. This definition is quite different, however, to the Ministry of Ethnic Communities, who also include continental Europeans in their definition. In Aotearoa, New Zealand, Asians, Middle Eastern, Latin American, and African people and communities continue to be invisible in research, government data, policy, and in planning. Communities are often reluctant to engage, and therefore little is known to actually drive that policy forward. Having invisibility in policy impacts on communities, their lived experience, and it includes their experiences of marginalisation and their health and their well-being. And so there's multiple layers that we're dealing with here. Aotearoa's ethnic population make over 20% of New Zealand's population right now, and by 2048 we're set to grow to 37%. Most ethnic minority people are of working age, and they fill in gaps in the workforce higher compared to European people. Ethnic minorities contribute quite significantly to New Zealand's social, economic, and intellectual growth, despite being quite invisible in policy. In this presentation, we're going to highlight how the invisibility is impacting on the mental health of young Asian people. So ethnic minorities in Aotearoa are a very highly diverse group based on their countries of origin, ethnicities, cultures, religious affiliations, the languages spoken, pre-migration, histories of colonial and intergenerational trauma, and also medical dispositions. There are, however, threads of commonality between all of these groups. Communities are deeply linked to their cultural values and beliefs and are from collectivist cultures usually. Educational achievement, diligence, and perseverance are also quite highly valued. This often does lead to pressure on communities to uphold the perception that they are successful, accomplished, and resilient to external pressures. And this is known as part of the healthy migrant. The pressures lead to adverse mental health consequences, and then those mental health outcomes in turn become hidden as a stereotype becomes the barrier to actually accessing that mental health support. Communities also face high levels of discrimination and racism, both in the form of interpersonal racism, so people being racist to them, but also structural racism through not being explicitly included in policies and service design, despite us knowing that there are higher and increasing needs for this population group. About 20% of New Zealand's youth are from ethnic minority communities. Ethnic minority youth increasingly identify with multiple and sometimes shifting social identities. Default approaches, however, in the data tend to describe their experience and their needs as singular. So sometimes or often the data only looks at a single dimension of identity, and usually that dimension is ethnicity, rather than looking at the various parts, as we can see on this little diagram here, that there are so many parts of identity that make up who they are and how these work in tandem to create identities overall. An intersectional approach provides opportunities to better understand how various social identities afford advantage or disadvantage because of the way that societies and services are structured and set up, and these influence on mental health and well-being. So if we look at this diversity wheel, it's a useful tool for thinking about how different personal characteristics intersect with systems and with structures to shape a person's experience. If we look at the middle here, we've got personal. These are primary dimensions of diversity like age, ethnicity, and gender, which are shown in the center. A person is also influenced by their environment that they're in and the social and cultural factors that they experience and learnings that they have from their family, their friends, work, community, and their belief systems. And then within organizations, a person is influenced by the group or the area in which they work, the structures and processes that they operate within, and sometimes these organizational structures can include systemic barriers and bias. So one way of understanding why different populations experience risks differently is to use the intersectionality framework. And intersectionality is quite a big buzzword that has kind of popped up over the past decade or so. And so I hope quite a few of you have heard of this term. It is a word that's been coined and mostly attributed to this woman up here, Professor Kimberly Crenshaw, who was a legal feminist scholar based at Columbia University. And the fundamental premise of intersectionality is that human lives cannot be reduced to just one social category or one identity. Social identities are constructs, they're fluid, they're interactive, and they're flexible. And so people can have diverse identities. Some are privileged and some are marginalized. We can be both oppressed and the oppressor as we occupy spaces simultaneously in our identity. Marginality is therefore not marginality is therefore produced rather than being predetermined and is outside of identity itself. So, for example, being a woman, there are disadvantages not because of the fact that they're female per se, but because of the interconnected structures and systems that shape the ways in which men often tend to be more privileged than women in today's society. Experiences of marginality are contingent on time and place, and so they often move and breathe within different contexts. And so life can be experienced quite differently, even if just one or two identities fall into a privileged group or a marginal group. Intersectionality theory highlights that social inequalities are not caused by the identities themselves, but because of asymmetrical power relations between often two different groups. And that stems from the systems of marginalization. And so if we want to recognize inequality and we want to work against inequality, it's really key for us to look at power and intersectionality and how these work together. And so if we use this figure over here on the left of my screen, as a real-time example, we can see that if we plot our own identities and circumstances onto this frame, we will see that advantage and disadvantage can exist simultaneously, like I was saying. For example, someone can hold in education, and so they are over that line of domination that's seen as a privileged identity, but then they could also be poor or have a racialized ethnicity. And so even within a single ethnic group, there is still this line of domination and advantaged and disadvantaged. And so poor mental health can be a driver because of all these high-level structural and societal drivers. And so to effectively respond to the mental health crisis, we have to recognize the diversity within communities. So a good one is even looking at colorism and how does people's skin color impact on how their experience is within a certain ethnic minority group. And we have to contextualize causes that are placing marginalized young people at risk, and we have to address those causes. A one-size-all approach largely favors those who are above that line of domination, and so those who are experiencing those privileged identities when we try the one-size-fits-all. It assumes that the one-size-fits-all will work for everyone, and it won't. We need needs-based approaches that are culturally responsive. For this, we have to acknowledge the diversity that is within Aotearoa and within our ethnic minority population, and we have to accommodate the diversity in the care and the services that are provided. However, this is not an expectation that every single service becomes proficient in every single particular culture, but instead what is needed is a response that enables all individuals in that society to feel valued and included. And so we often talk about this idea of safe spaces, and a lot of this literature that you're going to see on the screen, it feels a little bit messy for a second, but it's from a scoping review that Vathika, I, and Roshni have been working on for quite some time, and we're looking at writing it up. And safe spaces, often we hear this term, we don't really know what it means, and so we're here trying to actually gather the literature on what it says in a scoping review. This is quite specifically though for physical spaces, so keeping in mind that youth also occupy other spaces such as digital spaces and that kind of stuff. But I kind of made it into a bit of a continuum just to show that safe space actually is quite a complex and nuanced term. Starting over here on this side with physical space, looking at how spaces can be welcoming, even facial reactions from practitioners, even having inclusivity on clinic walls and the posters that are put up. So the physical space itself is really important. And then we start to kind of move into like this airy-fairy space around people's emotions and feelings that we can't really quantify, but they're still there. So ethnic minorities feeling emotionally secure, practitioners holding the space so that people feel heard and listened to, and that their lived experiences are validated as opposed to just being kind of brushed off. There's also a section here around cultural humility, and that's looking at practitioners and how they're kind of engaging with these populations, self-reflection, empathy, active listening, flexible negotiation. These are the things that are quite important for practitioners to show. And then on the other end of this continuum, we've got addressing power dynamics. So things like decentering whiteness, and that comes back to this idea of having practitioners of color, using trauma-informed approaches, and having awareness of intersections and identity and systems of oppression and how those work together. And so we can see that safe space is not just a really easy, oh, I said hi to someone and then they walked in and it was fine. Safe spaces are quite nuanced and complex. Yeah, I'm going to pass it over now back to Roshni. That's my section done. Thank you.
Okay, is the screen visible now? Yes, okay. Kira, Nikki, thank you, and thank you for ending it on the safe space topic, and Vartika will touch on those aspects again based on the data that we have collected from our Thriving at Crossroads project as well. I will start off this part of the presentation sharing some evidence based on Asian youth, drawing from the Youth 2000 surveys series. And as I mentioned before, the issues are likely to be largely reflective of all ethnic minorities in Aotearoa, New Zealand, of ethnic minority young people in particular. In the Youth 2000 surveys, we ask young people about whether they felt or feel like they belong in Aotearoa, New Zealand. And this question was asked from students who were born overseas, and just over half of East Asians and 3/4 of South Asians secondary school students felt that they belong in New Zealand based on 2019 data. Reassuringly, however, 90% felt part of their school, and which was a good statistics to see. Moving on to relationships, 91% of Asian students report that their family always wants to know about the company they are keeping and their whereabouts, although a lower proportion felt that their parents care for them a lot. Taking some indicators of risk behavior, binge drinking is comparatively lower among Asian students in comparison to their European peers. But about a third of Asian students have reported that they had gambled at some time. So gambling continues or is an issue for Asian young people. Just 40 to 50% report that they had, about 40 to 50% report that they had an adult that they can talk to about worries from outside the family. So just about half of our Asian young people are saying they can reach out to somebody outside the family about worries. And just over 50% reported feeling safe in their neighborhoods. Again, safety in neighborhoods, something that they don't perceive as being significantly available to them. Some indicators of experiences of violence. So 10 to 16% of Asian students reported experiencing physical harm within the households, but also experiencing sexual violence. And this is not just at home, but outside as well. Considering the mental health indicators, 2 out of 3 ethnic minority youth, now this is talking about ethnic minority, not just Asian, experience good well-being. 28% experience significant depressive symptoms. And this is depressive symptoms that are not just a feeling of being low, of low mood, but significant depressive symptoms that usually would need clinical assessment and potentially treatment, so at significant levels. and 22% have experienced self-harm in the past year. And in comparison to their European peers, at a population level, the proportions are comparable to that of their European peers. However, mental services access and provision largely lags behind in meeting needs of ethnic minority communities and young people compared to that of Pākehā or European New Zealanders. When we disaggregate the mental health data by East and South Asian and female and male, well-being is lower for Asian females than their male peers of the same ethnic group and have higher experiences of significant depressive symptoms and self-harm. So there is particular needs amongst our ethnic minority young girls. Currently available data on the usage of Access and Choice program, which is the primary mental health services, is lowest for the Asian population. The data provided in this table on the slide is encompassing for all age groups. Among the 12 to 24-year-olds, the use of integrated primary mental health and addiction services is just 8%. So 8% of all users identify as being Asian, and only 1.4% of all those who are using secondary infant, child, and adolescent mental health services are Asian, the lowest among all ethnic groups. And so despite high needs and similar prevalence rates amongst Asian and European peers and their European peers, access and usage is minimal for Asian young people. And not entirely surprising, the report from the Mental Health Commission notes, given that Asian communities were not one of the priority populations during the design of the program. And therefore, even if New Zealand meets its mental health targets, such as faster access to services, with very low health service engagement, many Asians with mental health needs will not be reflected in those statistics. While Thriving at Crossroads found mental health support critical to surviving and thriving, young people were frustrated with the lack of awareness and understanding of their lived realities within the system. And as one participant noted to us, and I quote, "It feels like you had to do something drastic to even get the help that you need," unquote. And they ask for a system that is informed and aware of the unique challenges that they face. Asian youth find New Zealand's health systems to be complex to navigate and not flexible. And some reasons for this is summarized in this report that I've shown here, which we recently launched at Parliament. You may access the report using through the Thriving at Crossroads webpage. And some of the reasons include the lack of culturally appropriate services and culturally safe modes of care. This is deterring help seeking among Asian young people. The Western-based service models with health professional training largely being Eurocentric is failing to meet their needs, as is the limited diversity within the health workforce. Affordability is an issue, including the funding models being not culturally sensitive, with expensive interpreter services also being a barrier to seeking help. Mistrust by poor experience once they access services, including stereotyping or the lack of private and confidential care, and the discrimination experienced is deterring help seeking. Societal expectations on our Asian young people for being a resilient community, upholding the model minority myth, also is acting as a barrier, and cultural barriers around mental health stigma is also playing a part. This report also summarizes the factors that are preventing young people from thriving mentally and emotionally. And these include, and is summarized on this slide, experiences of bullying and feeling unsafe in schools, but also in public and social settings. Racism and discrimination for this population group is a huge problem. Experiences of being stereotyped in schools, in the community, within healthcare, high and unreasonable expectations and pressures from teachers, from parents, at the workplace and in the communities also contributing to the mental health declines. They have a low sense of belonging amongst peers, in schools, and in wider New Zealand. And young people would tell us sometimes they are told you are welcome, but you are always reminded that you are different. The lack of connectedness, the lack of peer support, loss of established family networks, social isolation and loneliness are also contributory factors. They're caught in between the two worlds, and Vatika will talk to this a bit more about having to be Kiwi, but also being ethnic minority, the cultural dissonance, the conflicting values, negative pre-migration experiences, and post-migration stressors that are affecting all our young people, I must say, housing, poverty, also language barriers for ethnic minority young people, worries about family left behind, intergenerational and childhood trauma also playing a part. We explored the protective factors in this particular study for Asian rainbow young people, and family acceptance, feeling safe at home and at school, and having caring teachers were important protective factors. In the Youth 19 survey, we asked them what would help young people who feel down, and they provided really valuable insights into the importance of ensuring family, teacher, and friends know how to support young people when they have challenges. The importance of ensuring mental health and support services are accessible, culturally and developmentally responsive. The need to ensure all young people have opportunities for connections in their communities and opportunities to thrive. The need for addressing violence, racism, discrimination, the climate crisis, the housing crisis, the food insecurity, and the lack of opportunities. And so whichever way we do collect our data, our young people have reinforced and repeatedly told us that what can minimize harm to their mental health. We know what is needed. The will to focus on the prevention and deliver responsive care is our responsibility now to deliver. Unfortunately, however, for the young people of today, life has got tougher, which is challenging their lives and impacting on their mental health, whether it is the disinformation that is prevalent, whether it is an incredibly high unemployment rate amongst youth, the material hardships, homelessness, the toxic masculinity that is raising its head here in Aotearoa, New Zealand, and the experiences of racism. Things have got really hard for our young people. But youth mental health is a human rights issue. Young people have a right to be protected from known harm to mental health. As a signatory to international law, New Zealand is obliged, the government of New Zealand is obliged to ensure that policies don't discriminate. They're obliged to protect its youth from third-party interferences like big tech and to adopt measures to achieve equity. Many of the known harms are a result of external factors, including policies or the lack of policies that have led to and amplified diverse forms of exclusion, which are critical drivers of mental health for our young people. Drivers of social exclusion are structural. The consequences are, however, experienced by young people in their everyday lives. While we appreciate and acknowledge that there is considerable ongoing effort to address youth mental health, in Aotearoa, New Zealand, we must also understand that there are powerful structural forces that are driving the mental health crisis, causing harm, particularly to marginalized young people, including Rangatahi Maori, Pacifica, Asian, young people with disability, and rainbow young people. And on that note, I will hand over to Vartika to share some findings from our Thriving at Crossroads
Thank you,
study.
Roshni. If you can stop sharing, then I'll share my slides.
Yes.
Just give me a minute. Can you all see the slides?
Yeah.
Cool. Thank you, Roshni. Kia ora koutou. Glad to be presenting the slide, the findings from the Thriving at Crossroads. What I'm going to do now is talk more about the nuanced qualitative findings that we had from the project to really demonstrate the lived experiences of our ethnic young people, and then present some of the findings more aligned with the solutions that young people offered in terms of what can support them to thrive in New Zealand. But first, talking about the challenges that were shared with us by the young people who participated in Thriving at Crossroads project, they really spoke about the hierarchy of different identities that they experience here in New Zealand, but particularly more around the idea that they felt that they were forced to mold into certain identities in terms of the sociocultural practices and norms, and experiencing discrimination in terms of their body image, in terms of even just the texture of their hair, and that kind of pressured them and made them feel quite isolated and quite discriminated. But on the other hand, they also spoke about the protective effect that being in the wider New Zealand context provided them in terms of their marginalized identities, whether it is their gender or sexual identities. But while this was in context of the wider New Zealand, in terms of the ethnic communities, they also felt a sense of isolation, because when it came to the additional minoritized identities, they felt that they did not have the space to talk about them. They felt that there was a pressure to hide and avoid and discourage themselves from disclosing those identities. And I think that made them quite lonely and isolated as they kind of struggled to find a way to fit into these different spaces. So they were trying to kind of navigate their identities in different spaces without really having a sense of belonging in any of them. We also wanted to see how the wider New Zealand perceived our ethnic minority young people. So we had a look at the articles in the mainstream media, and we were trying to understand that how ethnic young people are presented for the wider audience. And three main themes sort of emerged from that analysis. One was most of the media stories that were about this population, they spoke about how young people, ethnic young people, have often a rough start, but then they get on to achieve their goals. And that happens only because there is a lot of hard work and persistence. So really kind of creating this image around how if you work hard enough, it is possible for you to achieve your dreams. It is possible for you to get to those aspirations. And there was also this sense of acknowledgement where young people who had achieved kind of suggested that they would want to give it back to the community. So again, highlighting the idea that there are some unmet needs in the community that the young people thought that it was their responsibility to give back to. The other theme that we identified as a part of this analysis was how many of the stories demonstrated that if there is any sort of discrimination or racism or the experiences of being othered, that happened in the past. And perhaps that no longer happens now, or that happened in rural areas, but not in our cities. And so really painting this image about inclusive modernity, that New Zealand is very welcoming, we are very inclusive. And if you're hearing stories about discrimination, that is something that is a gone by era, and we don't really experience these things now. There were few stories that did talk about current experiences of racism. There was something from Auckland Grammar School. There was an incident from Christchurch where there were aggressive incidents around discrimination. But it was quite interesting to see that every time those stories were presented, there was also this counter narrative to kind of push back on the idea that perhaps it was a joke that went too far, or perhaps it was a joke that was not taken as a joke, but not really an experience of racism. So overall, what we kind of summarized from the media analysis was how there was this idea of presenting New Zealand as inclusive and modern, and a place where our ethnic young people can thrive, but that actually was not providing a full picture of the experiences that our ethnic young people across a wide range of research projects that we have were talking about. So again, a positive image of young people, but not being true and authentic to their experiences. So we didn't want to stop with just identifying the problem, but also wanted to understand from young people or what they think might help in supporting them thrive in New Zealand. And there were some themes that came up during those conversations that we had with our young people. One of the first one that they spoke about was valuing the spaces for conversation and connection. Young people highlighted that identifying themselves and figuring out who they are and what they want out of life is quite a individual experience, but for ethnic young people it can be quite nuanced, and without the right support system, without having people who can actually help them through that journey, it can be quite isolating. So they really valued the opportunity to have space for those conversations where they can have authentic conversation. There was also a suggestion about how it might be helpful if people in the mainstream New Zealand are more aware of the experiences of people of color, particularly about their cultural heritage, particularly about their migration experience, and develop an appreciation for those experiences and understand that nuanced context in which ethnic young people experience their lives. The other point that that came up was around the value of diverse representation, and that wasn't in the context of just health, but also in context of the education sector, in terms of the political leadership. So across the society, the ability to kind of see people of color, to make sure that they feel validated, and also for them to see an opportunity for them to be in those spaces. There was this desire to be accepted for who they are. And again, highlighting, while this might be something for all the young people, but particularly with the nuances, with those marginalized identities that many of the young people come with, and particularly as I spoke in my insights from the in-depth interviews where people were talking about ethnicity as being the single marginalizing factor, I think acceptance becomes more challenging. But young people did talk about how getting the right support so that they are accepted, and their identities and that experience that comes with different multiple identities can, if that is accepted and supported, that would be valuable. Finding one safe community, again, getting the opportunity to get connected with those who have the shared experience, having similar identities, can be very helpful in what otherwise can be quite an isolating and a frustrating journey of identifying themselves. This is a quote from a young person who spoke about open and honest and vulnerable and supportive, and having the opportunity to reflect with people who can validate, and in that process for them to feel empowered about who they are and getting that confidence to share their journeys. Young people did talk about that when they are invited into spaces to talk about their experiences, that can be quite overwhelming for them, and that can feel quite lonely and very burdensome to kind of represent their own community and talk about those challenges. But there was also the idea that it is something that is an opportunity for them to make people aware of their experiences and let people have the opportunity to appreciate what it means to be an ethnic young person. So there was this mixed feeling around those sharing journeys, and particularly in the wider mainstream spaces. Setting boundaries was something that young people strongly spoke about. And again, it was about this challenge that they constantly have about navigating two different worlds. There is this expectation that they would value their culture, their practices that come from their ethnic identity, but at the same time, being in Kiwi expects them to be more like the wider New Zealand system. And that is the tension, that walking the tightrope between the Kiwi and the ethnic culture. And this is something that they wanted to would appreciate some support around. And as one of the young person did say, that it is all about accepting who you are and not having to constantly put the pressure on young people to be able to be able to align with both the worlds in a similar way. So it is about accepting who they are and making sure that they are not molding themselves and seeing this as their own society without the pressure to be one or the other. Last but not the least, they did talk about there was a sense of gratefulness, there was a sense of gratitude and appreciation of what New Zealand has to offer. And young people were quite appreciative of the idea of having access to high quality education, healthcare, the space that we have, particularly the bountiful nature that we have where they can go for a swim or a walk. So again, very appreciative of that. But that did not dismiss the disadvantages that they experience. And that's how one of the participants kind of summarized it, saying that I think the highs are so high and then the lows are so low because the highs are so high because our lows are so low. So again, talking about this kind of extreme experiences that they have, one of where they feel acknowledged and appreciated, and they are able to get from what New Zealand has to offer, but at the same time, constant experiences of discrimination can make them feel very low. So, and then young people are kind of tossing between these feelings almost on a day-to-day basis. To kind of sum it together, there were some overarching recommendations that we have drawn from across the project. So from Thriving at Crossroads projects, the research that we had, the hui that we had in the beehive. And this on the right-hand side, you can see there's a snippet of the briefing paper that was submitted to the Mental Health Minister, Honorable Minister Matt Ducey, talking about what would help our young people to thrive. I just want to say here that, as you can see on the title of this briefing paper, that this was about Asian mental health, but these recommendations can expand and are very relevant to our ethnic minority youth as well. And some of the overarching recommendations were around addressing the limited research of primary mental health services. Roshni just spoke about how Access and Choice, for example, has been a hugely successful program, and perhaps we might meet the mental health targets, but it would still not be catering to the needs of our Asian and ethnic minority youth. Improving access to specialist service and reducing the ED stays through better early intervention, and more importantly, being able to provide a crisis support that is culturally safe. Increased representation and cultural safety across the mental health workforce. Again, talking to the whole idea that by incorporating cultural safety across different dimensions of healthcare, there's an opportunity to make the services more accessible, more available, and more acceptable for our ethnic young people. There's a need for stronger focus on prevention and early intervention, which is tailored to the inherent diversity, uniqueness, and strengths of our community. We did talk about the data gaps that exist, particularly in the way the data is being collected across the different research projects, and the national level data that we have speaks to the fact that we continue to be invisible in the data. And again, having an opportunity to kind of have a more disaggregated data where we can see the different nuanced needs of each of the subpopulation groups within the ethnic minority communities would be hugely helpful. And last but not the least, addressing the representation gaps in mental health leadership and decision-making is something that can help in supporting our ethnic young people, help them thrive. If you would like to access the briefing paper, it is available on the Thriving at Crossroads web page. I want to wrap up the presentation with this slide, particularly because we want to acknowledge that colleagues like yourself serve all members of our society with respect and dignity. None of us, whether we are in education, we are in healthcare or social service, come to work with the intention of discriminating or reducing opportunities for those we serve to thrive and lead the best lives they can. But just sometimes the bias we may hold or the way in which our institutions are structured or have evolved over a period of time fails to build the trust we seek, especially with marginalized groups. So for those of you who have joined us today, it might be helpful to reflect on these three dimensions, the dimensions of power, trust, and bias, and at different levels. As you can see, we have listed systems level, institutional level, department, and individual level. And it might be helpful to kind of reflect and see, because these dimensions don't act individually, but they don't act in isolation, but they actually interact with each other and have an impact on mental health and well-being of our ethnic young people. So it is important that we are able to recognize the power differentials, not just between us and communities we serve, but also between us and the decision makers in our workplace, and how that influences the way we serve. With that, can I pass it on to Roshni again? Thank you. I'll stop sharing.
Kira, thank you, Vatika. Yeah, and sorry, Bev, we've gone over time, but as you can see, we have so much to share. And I can see that there are some questions on the question and answer panel. Do you mind if I respond to those questions as a start, Bev?
Yeah, kia ora, to all three of you, thank you so much. There is a wealth of information, and also the way you just storylined the presentation, which took us through from thinking about diversity and intersectionality through to what the data has said from different studies, through to taking us through to, well, what can we do about this, and getting more of a sense of the actual context of things that are operating together. I'm just going to read out the questions. The first one was actually about, oh yes, the presentation will be made available. We're recording this and we'll be releasing that as part of our webinar library, but also it'll be on the Thriving at Crossroads research page. A specific question, I guess, around the resources available linked to Thriving at the Crossroads in terms of participant stories. Is there any publications or specific resources providing more depth about that?
Yeah, so the publication on the interviews that Vatika led is available on the Thriving at Crossroads webpage. So if you go into the outputs page, it's available on that page. And also recordings from multiple presentations that we've done through the years. We are still in the process of writing what would help, and hopefully we'll get that done early next year. And so can share some bit more detail on that work. But Lindy, happy to reconnect and have a discussion if there's anything that you would like to talk through with us while we wait for these results to be published, which can take a while. But please do reach out. We can put in our emails in the chat so that it's available to everybody to get in touch directly with us. So thank you for that question, Lindy.
And then the other question is around, I'll read it. Kia ora, thank you all for this amazing work. Hopefully the findings will be utilised for concrete positive outcomes. Is there ongoing work to collect data for African youth? If not, is this part of the next steps?
So Thriving at Crossroads included Asian and ethnic, all other minority groups, including African young people. Although there were more Asian young people, just given the distribution of the demographic within New Zealand as a whole. Would be lovely to be able to do African young people focused research, but unfortunately at the moment we don't have the funding to do that. And so while there are no plans for future data collection, because our funding for this project is also coming to an end, we are hoping that, the prevalence survey, for instance, that's going out next year, will be able to use that data to kind of get survey data reported for ethnic minority groups, including African, if we have enough of a sample size, to be reported separately, and that hopefully might lead to other work, because we do realize that the wealth of knowledge comes from qualitative work and having discussions with young people. So we are hopeful that there will be opportunities for future work, but at the moment we don't have clear plans going forward to do a African youth specific piece of work.
Rashmi, can I jump in just for 1 second?
Yeah.
Yes, I just wanted to add to say that while Thriving at Crossroads is coming to an end, we have an ongoing other Health Research Council project, which is more focused on identifying community-led solutions. So very much like Thriving at Crossroads, again, it is brought with the idea that we include all the ethnic communities, including the African communities. So we continue to, in our small way, we do continue to engage, and we are still to publish those results and in fact analyze them, but we have got some responses via the online survey that we are doing, and we're also looking forward to speaking to some of the other ethnic youth. And we are mindful that because it's qualitative, we are purposeful in sampling, and we'll make sure that we have African voices fed into that as well. So this is work that is ongoing, but just to say that yeah, we are on this journey and continue to work with all the ethnic communities. Thank you.
Thank you, Vatika, for the reminder. Yeah.
So just checking, Roshini, were you able to put your contact details in the...
I'll just put my email and I'll put Vatika's as well.
Oh, that's great. Thank you. And I have just put up a wee, but it hasn't come through as a link, I don't think. I'm going to try that again.
I'll put it on the chat, on the question and answer.
Yeah, I was just posting a feedback form before I close, survey feedback form for peeps to fill out before I close the webinar off. Just having a look here. See if I can pop that up again. I've popped it into the chat. And it just is literally like, I think 3 or 4 rating queries. Oh, why isn't that working? No, that's not a link either. Copy link. I'll try this again. Yes, although not the short form version, you'll see a very messy link to click on for the audience if you would like. I just see it's just at 1:01 now. So I'd just like to thank people for coming along to this session, and especially to Roshini, Vatika and Nikki. Really pleased that we've had the privilege to provide you an opportunity to talk about the mahi that you've done and the kaupapa, and really pleased that there are connected things ongoing that continue this journey, because it's such an important journey in my mind, especially reflecting on that huge diversity, which is only growing rather than, and which means that the need will grow as well. So the importance of addressing it is also increasing. So just to close us off, I'm going to share the screen and provide a closing karakia. Kua mutu a mātou mahi kumo tēnei wā. Mana kitea mai mātou katoa. O mātou hoa, o mātou whānau, aio ki te arangi. Kia ora everyone, thank you so much and go well.